Great. Okay, so look, what we're going to do now is we're going to look at this patient's posture. So the first thing I'm going to look at is from behind. I'm going to see where that spine goes, if it's straight, if there's a curve. If there's a curve or a scoliosis, there are certain corrective exercises that we can use, especially if it's less than like 30 degrees, something like that. She's got a slight, what we call sway back posture, so you can see there's a little curve here. We're going to look at the pelvis. We're just going to have a look and put the thumbs in the dimples of Venus here, and we're just going to see, some people, you can see that one leg is longer than the other, but she's got pretty good. We're going to look at the creases in the knees, just to check they're the same. Is she bending the knee? Is it straight? And then we're going to look at the ankles as well, especially down at the Achilles tendon. We're going to see, is there any sort of deviation, any... The other thing to look at are the shoulder blades. So we're going to pop the fingers under here, and we're just going to see, you can see she's slightly down on one side compared to the other. Can you see that? Great. So we're just going to finish up now with the neck itself. So I'm going to ask you to turn sideways if that's okay, just there. A little bit more. That's it. And we're just going to see some of that neck posture, and we're going to see, is it forward, is it backwards? Now, the most common postural problems are what we call the upper cross pattern, which is where it's a kind of slouched shoulder forward, slouched down. So that's a really common problem, especially with people that are on the mobile phone a lot. Oh, I wouldn't want to keep you there, you stay straight. People that have sort of down on the phone, people with computers. It's a kind of a lazy posture, it's a kind of default posture. So we're going to cover a lot of those exercises, how to correct that. The other one is what we call the lower cross pattern, where there's a kind of sway back that engages certain muscles here, like the serratus posterior inferior, and we're going to cover a bunch of exercises to help correct that one as well, the lower cross pattern. They're the two most common sort of dysfunctional patterns. And again, the other one is the head forward postures, and also this kind of cervicothoracic hump, or buffalo hump, they call it, which can happen. We're going to cover a bunch of those exercises as well. So this is a pretty straightforward postural analysis. Wait till you, so this is a pretty straightforward postural analysis. We're going to look at the posture in much more depth in the book and cover a lot of the corrective exercises that you need with Gabrielle, our model. Thanks.